Hello, my name is Luke Dakota. I am a nursing student and I'm here to work with you today. Closing the door, make sure we get some good privacy in here. Can you please tell me your name and date of birth? All right, I see you've got the armband that matches what you said, and then I'm going to check it on the system to ensure that that is the same. So your provider has ordered for you to have an indwelling French 14 catheter. Seems that you have some urinary retention, and so we're going to be we're looking to put that in today to relieve the urine in your bladder. Would that be okay? Okay, very good to hear. All right, are you allergic to betadine or latex? Great, good to hear that too. Okay, I'm going to go ahead and start with this. Well, before I do that, let me go ahead and I forgot to wash my hands. And so before I would have touched the patient, I should have washed my hands. So I'm rectifying that now. Okay. So we're going to raise the bed up to waist height, and then we'll be getting into position. All right. All right, so we lift the legs up. All right, how's that? Okay, good. So now we're going to go ahead and open this thing up. I'm going to use this bag as my garbage bag. Okay. All right, so those gloves are too small, so I brought my own. Under the cuff, which I just touched the inside of the glove. It is a sterile package, but still, I did touch the inside with my thumb. All right. Okay, discard this. And this. Let's go ahead and set up the lubricant. I'm going to open this, put this in here. Drop that there, okay. And we're going to dip this in here, get it all nice and lubricated. Making sure to not touch my glove on the bed. All right. Okay, so I'm now going to connect the syringe to the catheter. Okay. All right, so now I'm going to open up my package. One down the middle, drop it. The far side. I did that twice. I should have only done that once. And then on the near side. Okay, so now I'm ready to insert the catheter. Okay, I'm going about 3 inches at this point. Okay, I'm going to inflate the catheter. No, I'm sorry. I've gone in, and before I inflate the catheter, I'm going to check for fluid output, and then I'm going to go another approximately 3 inches, and then I'm going to inflate the catheter. Okay, so I inflate the catheter, and then I pull back until I feel that the catheter is tight against the bladder, and then I would come here and release. Okay, at that point, the sterile part is over. Okay, so then we're going to secure the catheter to the leg. And I've got my tape set up over here. Okay. All right, we've got it hanging here. It's not touching the floor, but we don't want it elevated above the patient. So then at this point, I'm gonna clean this up. Throw this away, and then put the patient back into a neutral position. Okay, so now that I'm done, I'm going to lower the bed. Okay, do you have any questions or concerns about what we've just done? We will be back to check the output, and hopefully that will be relieving your urinary retention. Okay, so then clean up the rest of my mess. And I would then take that out. And I would also put that in my trash bag. Okay, so then we're done. The patient's bed is lowered in a comfortable position. Okay, so I'm leaving out the room. Okay, so hello, it's me again, Luke Ducote. I am your nursing student. Let's once again verify. Can you tell me your name and your date of birth? All right, that looks good. Check it in the system. That is the same. And once again, I forgot to wash my hands, so both times. Okay. Before I touch the patient, wash my hands. Okay, so now your healthcare provider has ordered for your catheter to be removed. And in order for it to remain out, you have to be able to have urinary output on your own. And so we're going to have to come back and check and monitor to make sure that you are doing so. So I first would check the bag, document the urine output in the bag. Then I would empty the bag and discard, unless it is requested some sort of lab work on the urine. But I was not told about that, so I'm going to assume not. Okay, so gloves. I need some, here we go, right here. All right, so we're going to remove your catheter. Is that okay with you? All right, great. Let's get this thing done. All right, so we've checked the output, we've emptied it. All right, so this is not a sterile procedure. All right, and I've got my syringe. Nice fresh syringe here. Okay. So I'm going to insert and deflate the balloon. Okay. All right, so then we're going to remove the catheter and check that the tip is still intact. Okay, we're going to remove tape. Remove the bag. and dispose of this. All right, so now we're all done. Again, lowering the bed, returning to a neutral, comfortable position. Okay, do you have any concerns? Do you need to try to go to the bathroom now? Do you have your call button? Do you need anything else while I'm here? Okay. Sounds good. All right. Thank you so much. And I'm done.